According to the World Health Organization, mental health is a state of well-being in which an individual realizes his or her own abilities, can cope up with the normal stress of life, can work productively, and is able to make a contribution to his or her own community. Why we need to care about mental health? Because mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle our stress related to others and make healthy choices. Mental health is important at every stage of life, from childhood and adolescence through adulthood. Actually, mental health is a real thing. We should never ignore our or someone's mental conditions. Talk to your near and dear ones. We never know what the people around us are going through, the battle they are fighting with. The World Health Organization has nominated 3 common mental health disorders, namely anxiety disorders, mood disorders, and schizophrenia disorders. Anxiety is a feeling of unease, such as worry or fear that can be mild or severe. Everyone has a feeling of anxiety at some point of their life. For example, you may feel worried or anxious about sitting an examination or having medical test or job interview. In mood disorders, your general emotional state or mood is distraught or inconsistent with your circumstances and interfere with your ability to function. You may be extremely sad, empty, or depressed. Or you may have periods of depression altering with being excessively happy. Anxiety disorders can also affect your mood and often occur along with the depression. Mood disorders may increase your risk of suicide. Some examples for mood disorders include major depressive disorders, bipolar disorders, seasonal affective disorders, cyclothymic disorders, persistent depressive disorders. Schizophrenia is a serious mental disorder in which people interpret reality abnormally. It is a chronic brain disorder that affects less than 10% of the world population. When schizophrenia is active, symptoms can include delusion, hallucination, disorganized speech, trouble with thinking, and lack of motivation. Mental Health Awareness Month is observed in May, but paying attention to and improving your mental health is important year-round. Here are some tips to keep in mind if you are really care for your mental health. Get plenty of sleep. Get well and healthy foods. Avoid alcohol, smoking, and drugs. Get plenty of sunlight and walk around. Manage stress. Use tips. Involve in activities and exercises. Connect with others and be sociable. Do things for others and make others happy. And most importantly, ask for help at any time you need help. Don't hesitate. Mental health is important to everyone. Make yourself priority. Let's make a better world.